We're going to talk about best treatment of wounds. This is aimed at everyone, both professional, experienced riders and amateur riders as well. So often there are multiple different treatments sold in various tack shops with little or no science behind them, and many of these are not that helpful, some can be harmful. We're trying to give you instruction as to the sensible way forward for the optimum treatment of wounds. How it's best to clean the wound and how best to dress the wound. The first thing to assess is whether it's a wound that you can deal with yourself or whether you need to call us, your veterinary surgeons. Critical to this is looking at, first of all, where is the location of the wound. Is it close to a joint or a tendon, especially around the fetlock, the knees and the hocks can be critical locations in a horse. Any involvement in a joint may well need surgery or thorough flushing. The next to assess is the depth of the wound. Has it involved any deeper structures such as tendons or muscles? If around the face, does it involve bone or the sinuses? Is there excess swelling? Is there possibly dirt or contamination such as hair, soil driven deep within the wound? Next thing to assess is the horse's soundness. Is he weight bearing or comfortable at the walk? Significant lameness can indicate involvement of deeper structures or possible other damage if it's involved, such as from a kick where it may be some bony involvement. The size of the wound is also important. If it's superficial or small and not gaping open, then it may well be cleaned by yourself, the owner, and dealt with. If it's deeper and gaping open, then it may require repairing with stitches or staples. What's also coming out of the wound? If there's been some hemorrhage and nothing else and it stopped, that may well be fine, as it helps to clean the wound. If it's some clear fluid or there's bubbling coming out of the wound, it may involve the joint or deeper structures with infection. Many mistakes are made with how to clean a wound. There are two real ideal solutions that you should be using. One is chlorhexidine or Hibi-Scrub. This needs to be at the right concentration, which is 1 part chlorhexidine to 40 parts water. If it's more concentrated, then it can cause damage to the underlying tissues and slow healing. If it's not concentrated enough, then it has little antibacterial effect. Another alternative is saline. This can be made up approximately yourself using 1 teaspoon of salt in a pint of water. The next is how to apply the solution to the wound. A very cheap and ideal way is using a garden sprayer bottle. This produces the ideal pounds per square inch pressure of the jet hitting the wound to remove debris and bacteria from the wound surface without damaging the underlying tissues. Wounds should be cleaned using swabs, cotton gauze swabs. Try to avoid cotton wool, as bits of this can stick to the wound surface. The next thing is to decide what you're going to apply to the surface of the wound, if anything. There are many different items when you go into a tack store or feed merchants, and this can be very confusing. Sadly, a lot of these are of little help. The horse's immune system is very sensitive to what we call foreign bodies. Anything that the immune system detects as not natural, it will produce an immune response to. So typically, if you think the wound's very contaminated, the ideal thing to apply is a hydrogel. Typically these are items such as Vetalintex gel or Intrasite gel. These are excellent for helping to clean, bandaging on and helping to clean the wound for 24-48 hours before cleaning again. Many people use Manuka honey and this can be great for keeping the wound surface moist. But however, a large-scale study of over 10,000 horses in the United States showed it was a benefit in only 50%. So patient selection is key. What you should avoid, however, is purple spray and wound powder. Purple spray has little effect but will produce quite an intense foreign body reaction causing discharge. And likewise with wound powder, although it may have some antiseptic properties, the powder substance on an open wound will cause a foreign body reaction. Next, come on to dressings. What dressing should you apply to the wound? Now, the one big don't is don't apply animal Lintex poultices to wounds. They have little effect in drawing out debris or dirt, and will also cause quite a nice substance for growing bacteria on the wound surface. So ideally you want a non-adhesive dressing, something that's not going to stick and damage the wound surface when you remove it. We use two types of dressing. Generally, the main dressing we use is a Melanin. This has little absorptive properties, but it is great and cheap for simple wounds. Always apply the shiny side to the wound, not the cotton side. The other alternative, if it is a larger wound or discharging, is the more absorptive dressings such as Aleve or Renofoam. These dressings can absorb several times their own weight in fluid and help to keep the surface of the wound clean. Bandaging has been demonstrated in one of our previous videos. Basically, the bandage, light cotton bandage, should be applied to hold the dressing in place and pad out the overlying vet wrap type bandages so they don't pull tight. The advantages of bandaging are they keep the wound clean, hold the dressing in place, reduce movement of the wound, helps limit swelling and prevent further contamination. We'll do a couple of illustrations now. This first picture is of a hock wound, probably caused by wire. Now, the crucial factors in this is location. It goes straight across the front of the joint. First thing assess is if the joint is involved, it may need flushing. Secondly, the extensor tendon travels down over the front of the hock. This will need to be seen whether it's intact in relation to how much bandaging and support we need to give. Problems with this wound is it will be difficult to stitch because the leg is constantly flexing and may well need a heavy bandage, otherwise the stitches are likely to tear through. Next wound is a cannon wound. The horse had run into a sharp object, causing laceration of the skin and deeper tissues down to the front of the cannon bone. Thankfully, the extensor tendon was intact in this case. So concerns would be, has damaged the cannon bone and then the cosmetic appearance that we're going to end up with. Rapid cleaning and suturing of this wound before the tissues around it could contract was important and vital. Then the horse then had a substantial bandage for a number of weeks, preventing swelling and pressure on the wound site. Careful bandaging by the owner and support and cleaning resulted in minimal scarring of quite a large wound. This last case is a head wound where the horse was kicked whilst being ridden. You can see there was substantial hemorrhage. The important things to check were that the bony sinuses underneath the wound were not damaged and the tooth roots were intact. This wound was closed to prevent further hemorrhage with simple sutures.
In summary, hopefully this demonstrates when or when not you may need to call a veterinary surgeon. Gives you ideas for simple and relatively cost-effective ways of cleaning and dressing wounds. It also helps to decrease our use of antibiotics with the current pressures due to resistance. If you have any questions, then you should contact the surgery.